There clearly is a very big unmet need in lupus. There are therapies, actually not so many therapies that are specifically approved for that disease, but we also use quite a lot of immunosuppressants off-label for this autoimmune disease. And with those, what we can achieve is that mortality of lupus has been reduced quite considerably, and also end organ failure, such as kidney failure, is now occurring less frequently than it used to in the past. But conversely, it is also clear that the majority of patients with lupus have quite significantly reduced quality of life due to the illness. For most patients with systemic lupus erythematosus, the disease means a daily struggle with symptoms and signs of the disease, the need to take multiple medications, including those that give a lot of side effects, and the risk of flares that is always there. So we think that for lupus treatment to work better, we would need to be able to control the disease better, and to prevent the flares. There's a very interesting story about ustekinumab, which is that it's an approved treatment for other diseases, for psoriatic arthritis, for psoriasis, and now also for Crohn's disease. And it's known that it blocks the cytokines IL-12 and 23. So it's an immunomodulator with a very specific mechanism of action. And a few years ago, some researchers and experts looked at all the available drugs that exist with the question in mind, which of these could potentially help for lupus based on the mechanism. And ustekinumab was one of the ones that they identified as a potential candidate. So they went to Janssen, the company that makes ustekinumab and markets it, said, wouldn't you test it in lupus? And understandably, Janssen at first said, well, it's a small indication, and we're already on the market since quite a number of years for other indications, so we have to think about that. But fortunately, they ended up deciding to do it because it turns out that what the scientists predicted was that this could actually help for lupus. And now we're, of course, looking at the results from the first clinical trial, which does seem to support it. So in this clinical trial, the patients were randomized. Half of them, or actually 2/3 of them, received ustekinumab, and 1/3 received placebo. And ustekinumab was given as an intravenous dose at first, and then subcutaneous injections. And the placebo was, of course, matching. And the patients could continue with their background medications for lupus. And what was used as an outcome, which is used in a lot of lupus trials, is the Systemic Lupus Response Index, the SRI, or sometimes called SRI-4. And that's not very intuitive because it requires a number of things to fall into place. But you could think of it as that means the patient has improved by what is a measurable amount, and things otherwise are also under control. And looking at that particular outcome, it was clear that that did happen sometimes in the patients on placebo because of the placebo effect, but it happened many more times in the patients on ustekinumab, the difference being 29% in favor of ustekinumab, and that was highly statistically significant. After 24 weeks, we had seen a very convincing difference between the two groups. Now, the patients who were already on ustekinumab continued on ustekinumab for the full year of the trial, and they maintained their responses. And it was important for us to know that this is also a therapy that can be continued and that can stabilize the disease at a level that is good and that it has continued efficacy. The patients who were on placebo were switched to ustekinumab at 24 weeks and continued until week 48. And among those, there were also improvements in the lupus indices. The improvements were more outspoken in some areas than in others, especially the skin disease and the joint disease did seem to improve also in them. And those were the two kinds of lupus that we see the most of in this trial anyway. What's also important is that the side effect profile in this trial was as expected. And expected in this case is based on the quite large experience in other indications. And that's a favorable side effect profile, something that makes it that you could think that, yes, this could actually be a treatment that I could use in practice for my patients. Well, as you know, this will have to be confirmed in another trial, a phase 3 trial. That trial is now underway. It started a few months ago. This will take a while because it needs to recruit hundreds of patients. That takes a while, and then the patients have to be treated for a full year. That takes a year, and then the data have to be analyzed. But I hope maybe in 2 years' time or so to be standing here with new results on ustekinumab in SLE. for the patients with lupus, it is encouraging that there right now are actually a number of developments with new therapeutics that are promising. Of course, we've also been disappointed in the area of lupus with trials that looked like they were positive and then the follow-up failed. But I think there are indications now that we are getting at the point where things are going to actually succeed and there's a brighter future for the patients.